That time of year, the sniffles start, people are getting fevers and body aches. The flu bug is about to attack. So can flu shots help you stay healthier this winter? Dr. John Shufeldt joins us this morning. So, doctor, what's the research show about the effectiveness of the flu vaccine?
Well, actually, the effectiveness is pretty strong. And physicians are recommending that people who are at risk get this flu shot, Contessa.
And who would be at risk then, doctor?
It's people who are over 65 years old, people with chronic illnesses such as asthma or other frequent pneumonias, people who are debilitated, who have a chronic medical condition should all definitely get the flu shot.
And they're relatively inexpensive as well.
They are. It kind of varies every year. This year, they can probably find them between $10 and $20 a shot.
Okay, another health issue that's gained a lot of attention lately, career women who put off having babies until after they're 40 years old. So is modern medicine helping on that front?
Well, actually, the study was actually women after 50 years old. And so they took it out a lot farther than people expected to. And what they determined is that, kind of women have two biological clocks. One for their ovaries, which typically runs out in the early 40s or mid-40s and then kind of contributes to menopause. And then after that, the reproductive organs themselves still actually work. So they had 121 women trying to get pregnant who were between 50 and 63 years old.
Wow.
Amazing. About 63 of those 121 women actually were able to get pregnant and deliver children.
But how dangerous is that for them?
What they determined was it takes a little more surveillance, but in general the risks are very well modulated and can be minimized to a great deal.
Okay, moving now from women over 40 to young men. Football season, lots of high school players out on the field. So how risky are those repetitive injuries they're getting?
Great question. What looks like is about 64,000 incidences every year of young male athletes getting concussions during football games. And what they've determined is these repetitive concussions really lead to some long-term problems. And I think the take-home point for this is that when your student athlete gets a head injury, they really need to get out of the game, get onto the sidelines, and then wait for about 7 days after those symptoms abate before they can really play again.
That might be another issue for parents to consider even before their student goes out to play football.
Yeah, absolutely. What they found is when they don't do this, they can have actually potentially serious, if not life-threatening head injuries.
Okay, Dr. John Shufeldt, thank you for joining us today. If you'd like to get hold of Dr. Shufeldt, you can visit our website at phoenix360.com. Doc, thanks again.
Thank you.